Hey, this is Brandon. I had one quick question that came in before I posted this blog from our board, and that was why do some Little League pitchers and catchers and baseball players get Little League elbow and others don't? And I don't think that's the right question. I think the right question is why do some people become symptomatic and other people aren't symptomatic? Because what we know is that when you, especially in the Little League elbow, is that you're going to have people throwing a baseball. These kids are throwing baseball nonstop, especially the pitchers and catchers, because they're mostly involved in the game. When you look at pitchers who throw between 600 and 800 pitches per year, which is nearly every single one of them, they have a 234% increase in having an elbow injury as compared to their fellow players. This is a big piece of the puzzle. They have a weak point, and that physis right between, or at the humeral head at the medial epicondyle, is the weakest part of the elbow. Not only is it the weakest point, it's also the point they're putting all that eccentric load through when they're throwing a baseball and go ahead and pitching the ball. So we need to be able to address that. The symptomatic population is to get it to calm down. But I think the question is referring to why are those people symptomatic? Because we know when it comes to baseball, all of those players are having hypertrophy. Looking at this slide right here, you can see that 100% of players, pitchers and catchers, are getting hypertrophy of that medial epicondyle, and 90% of the other players are getting that. So everyone is getting a pulling away, traction apophysitis of that area. The question is who's giving themselves time to rest? And that is part of your job. Your job as a doctor and your job as a parent of these kids. If you look right here, this is a picture of my son pitching. Guess who had medial elbow pain this year when he started pitching? My son. How big of a failure do I feel that I'm not there to keep on stretching him out and educating him on proper rest? So you rest assured that we'll be taking care of that this year. But it is a big piece of the puzzle. We have to be able to address this in our office and in our homes. So one thing that I do that I think is a great test is the moving valgus stress test, looking for ulnar collateral ligament apprehension, laxity, showing that there's a joint dysfunction there. So here's a video of that test. This is 100% sensitive and 75% specific for any kind of ulnar collateral ligament laxity. You're maximally flexing the elbow and then quickly bring it into extension with a valgus force, looking for apprehension or pain. Now this is looking for laxity. What are the best tests for actually looking at apophysitis in a younger athlete? That's your 13 and under. That's when you're going to have pulling away and actually a bone response. That's going to be your history, age, and then also looking at imaging. This is where x-ray is going to be the best tool because x-ray is going to look at bone. As soon as you get into ulnar collateral ligament injuries, ultrasound is a great modality, great imaging technique, and then also your MRIs are going to be great for that. Also, keep in mind, once they hit that 18-year-old, maybe 13 to 18-year-old point, that's when those ligaments become stronger than the bones. So you're going to have more ligamentous injury. We often diagnose these baseball players with tendinitis. That is wrong. Tendinitis is a wrong diagnosis if that pain's been there for more than 3 to 5 days. That inflammation should be gone. And if it's not gone, you need to stop looking at chemical sources of inflammation and pain and start looking at the mechanical ones, meaning more of a tendinopathy within those wrist flexors. There's a great protocol on how to address this and treat this in ChiroUp. Take a look at it, but once again, make sure you're addressing this properly. If you have a young athlete with elbow pain, more of a bone problem. That's where the weakest point is, right? The physes at that medial epicondyle. If they're older, between 13 and 18, we're looking more of a tendon or ligament issue. Most importantly, that ulnar collateral ligament. If they're in an older population, that's when we're looking at more of a tendinopathy within that wrist flexor bundle. We treat all those things very differently. So take a look at the blog. I hope this helps. Make sure we take that just amazing history. We dig into our patients' lives and to find out what is causing their pain and then exactly why that's happening to that person so we can get that pain to go away and keep it from coming back.